What's included in facial feminization surgery? A lot more than most people realize. From forehead contouring to jaw reshaping, from lip lifts to tracheal shaves, this video walks you through every option available. As a board-certified surgeon, I've helped hundreds of patients customize their procedures to reflect exactly who they are. If you've only seen basic checklists online, this video is different. We're going deep into what's possible, what's typical, and how to build a plan that fits you. FFS can be life-changing, but knowing where to start can be tough. Check out my complete playlist to guide you throughout. Who is a candidate for facial feminization surgery? Essentially, anybody who looks at their face and identifies something that over-masculinizes them, whether it's their hairline, their brow bone, their voice box, their nose. These are the people that are going to be candidates for facial feminization. Most patients that go through this process are going through a gender-confirming set of procedures. Not everybody needs to be transgender to have facial feminization. It's very, very important. Most patients who do are going through that process. What's included in facial feminization surgery? In facial feminization surgery, it's really up to the individual. So let's break down the most common procedures. In most patients, adjustment of the hairline. So if you look at what's considered a masculine hairline, it can be high, it can be different shapes. Usually it shows more of the forehead than we want. So hairline advancement is very common. Brow reshaping is probably the most common procedure that people will go through when people have a prominent brow ridge, prominent over the outside parts of the eyes. These are the patients that will benefit from forehead feminization. Rhinoplasty is also very common. Patients look at their nose and we try to blend it with the face that we're shaping. Cheek augmentation is another very common one, whether it's with implants or with fat. Jaw reshaping, jawline contouring, genioplasty, chin reshaping, and tracheal shave are the others that are the most common. Other additional procedures can be lip lift, buccal fat removal, eyelid surgery, brow lift. There's a number of different options. What we will do is help you identify what may be a concern to me and how do I build that as a plan to create my facial feminization procedure. What does the FFS surgical process look like? First step is we always start with a consultation. On average, we see most patients within 2 weeks. Most facial feminization procedures that I do are done in one stage. It's my preference. I'm very comfortable with it. It's how I learned how to do it. It's how I was trained very extensively. That being said, it's up to the individual. If somebody wants to break it up into other procedures, several procedures, we can do as little as one procedure per time. You're just going to go through recoveries every time. So most facial feminization procedures are done under full general anesthesia. So that means you go all the way to sleep. Anesthesiologist is there with you. Most procedures take anywhere from 8 to 10 hours when we're doing them in a single stage. Even with that, even doing 8 to 10 hours of surgery, most of my patients go home the same day. The benefit of that, you're home, you're comfortable. We will make sure you're safe. We will make sure that it's the right thing to do. But most of these are done on an outpatient basis. What does FFS recovery and aftercare look like? The recovery after FFS, it's mostly swelling. Everybody blows up like a balloon. It is always the worst part about working in, on, or around the face. There's nowhere for the swelling to go but outward. Consistent feedback from our patients is discomfort and pain are definitely present. One of the things that we pride ourselves on is what we call a preemptive approach for pain control. And so we make sure that you're taking medicine on a regular basis to prevent pain from going up into peaks. We like to just keep an even plane of general discomfort, which is easily controlled with medication. A medication typically constitutes an anti-inflammatory, Tylenol, and then stronger pain medicine, usually every 2 to 3 hours with that. We put a head wrap on anytime that we do forehead work, neck work. If you have a rhinoplasty, we will always put a cast across the nose. Those we will always do a post-op day 1, typically virtual follow-up, so you don't have to leave home. We do a virtual follow-up where the head wrap comes off. At that point, I let you shower, and after that, we provide you a wrap from the office that we'll then put on. That's when you start icing. So for the first couple of days, you'll put ice on there. And then after that you can transition to heat, or if ice is still comfortable, you do that. For most of our patients by day 3, they're either off of the stronger pain medication or tapering down on the stronger pain medication. Most patients between day 5 and day 7 are off of regular use of naproxen. By day 7 to day 10 they're off of any regular use of Tylenol. So a majority of the recovery happens within the first week. Most of that recovery is within the first 3 days. And again, it's mostly swelling, general ache, discomfort. We're going to put you on a soft diet for a couple of days just because it's the easier thing to do. We're going to make sure that you stay hydrated. We're going to make sure that you get up, you move around, prevent yourself from coughing, prevent yourself from, just getting too much of a slug in the chair or the bed. The more that you get up and move around, the better that you will feel. When will you see final results? For week 2 to week 6 is where you'll actually start to see a lot of things taking shape. So at week 2, you kind of look very similar to how you did the day before the surgery. At week 6, you're starting to see better definition. You're seeing, about 90+% of your swelling is gone. You can see a jawline, you can see your forehead, you can move your eyebrows, you can breathe through your nose. A lot of the functional and reduction of the swelling elements of the recovery are most of the way done. And then at the 3-month mark, which is what we call our final result, is you have about somewhere between 2 and 5% of your swelling will still be there. Most of that swelling takes up to about a year to actually go away. Most people from month 3 to month 12 don't really notice a lot of a difference because it happens over such a protracted time. Full healing cycle is about 12 months. And so that last couple of percentage of swelling takes up to about a year. At the 1-year mark is you will have a full outcome at that point with essentially no surgical edema at that point. What are the risks and considerations for FFS? The risks of facial feminization surgery are mostly related to numbness. We make incisions, so there's always a possibility that it scars more than we want it to. There's always a risk of infection. Main risk of infection happens between week 1 and week 2, and then closer to week 6. The risk of infection is about somewhere between 1 and 5% for most patients, and it's one of the things that we monitor the most closely. Other things like hematomas, blood clots, wounds opening or doing things that we don't want them to. These are generally very early parts of the healing process. By the 2-week mark, most of the wounds have most of their final strength. From week 2 and beyond, it's mostly just a management of the wound and non-active treatment of the wound. The most significant thing that people will notice is numb areas. So anytime that we work around the face is we're stretching on the nerves that provide sensation to your cheeks, to your lips, to your forehead. There's always going to be little patches of numbness anytime that we do anything up in the hairline. There may be short-term areas of numbness in the forehead, maybe short-term areas of numbness in the jawline or the chin. Generally, most, if not all of these will come back, if not entirely, very close to it, other than a couple of areas that we will always talk about relative to your final treatment plan. That being said, serious complications are rare in the hands of an experienced surgeon. This is why you want to do your research. This is why you want to make sure that your message is getting across so that your surgeon or myself will know exactly what are your goals, what are the outcomes you're expecting, and we can tailor our risk profile based on your preferences.